Hi, Dr. Scott here, and what I want to talk to you today about is pattern number 2 and pattern number 3, which is going to be under converting T4 into T3 or over converting T4 into T3. Now, on a previous video, we discussed to you that the thyroid makes T4 and it had to drop off that T4 to the liver for it to be converted into the active hormone because T4 is not active. It has to be activated. And it went through all the percentages. 60% was T3, 20% turned into reverse T3, and the other 20% went to T3S and AC. That got shuttled down to the gut and eventually got turned to T3. So let's talk about what can happen or the causes of underconverting T4 into T3. Many times it's a cortisol problem. Cortisol is a stress hormone. This stress hormone determines if you go to sleep and if you stay asleep. 50% of the time while you have hormone imbalances, and too much cortisol can actually lead to Alzheimer's, short-term memory loss. So to know if you have a cortisol problem, you need to run a saliva test to determine that, and we do that on most of our patients. Some of the other causes will be a leaky gut. Your gut's leaking food and bacteria, irritable bowel syndrome, food sensitivities can cause it, in particular gluten, dairy, or soy are the big ones. Any kind of inflammation, even SIBO, we see this a lot actually, small intestinal bacterial overgrowth. Listen, if you have constipation and you're bloating, you probably have SIBO and you got to kill it. So we look for it. It's called a breath test. You have to determine for SIBO. But hepatitis and fatty liver, and some of this sometimes all started with taking an antibiotic for something and it killed all your bacteria. And there are some medications that actually can promote the non-conversion of 4 into 3. Okay, so that's what can happen with underconverting. The other problem is you're over-converting T4 into that inactive hormone, reverse T3. That becomes a problem because it won't turn your cells on. So some of those things that can happen is, number one, too high of cortisol. Even too low of cortisol hormone can be a problem. Typically, we're looking for a person that has insulin resistance or diabetes that's not regulated properly. Even low iron levels, anemias. I see a lot of anemias missed because most doctors just look for iron deficiency and that's it, but there's over 50 causes of anemia. They can affect these enzymes of conversion. Lyme's disease is a big one. Any chronic condition or infection, and again, there's even some medications that promote conversion into reverse T3 instead of the active hormone T3. So those are the conversions. Now, what do you do about some of these things? Well, first off, selenium, vitamin D, zinc, dopamine are all required for those enzymes to work right for conversion. So you need to make sure those are adequate. You also need essential fatty acids. Essential fatty acids are crucial for inflammation, good for your brain and your heart and a lot of those other things. In fact, essential fatty acids are one of the most important things. They're also called omega-3s. So you're going to need those. You really need a supplement with a good solid supplement. If you don't know where it's coming from, a lot of these supplements have PCPs or mercury in them and you're going to have a problem with that. Okay. So, and I'll talk to you a little bit about some options for essential fatty acids.